I joined ICRC in 2001. I work in several countries like Yemen, South Sudan, Afghanistan, various activities from prison visits, visiting detainees, detained in connection with the conflict or not, or political detainees, also participate to food distributions, activities connected to the dissemination of the law, promoting the law, teaching of the law to armed forces, and also in the management. I was in charge of the north of Afghanistan, coordinating all the activities, or Darfur, and other places like that. I started playing video games at the age of 10 or 11. I think my first was a game console, playing tennis. And I never stopped playing games. So the International Committee of the Red Cross, ICRC in short, is a neutral, independent human organization. It was created 150 years ago, in fact, on the battlefield, to reduce the effect of armed conflict on the non-combatants. Of course, we also care a lot about the armed forces. We contacted almost all the private companies making video games, and we express our interest to use video games as a vector to promote some message, like about the protections of wounded, or the fact that on the battlefield, not everything that's moving is a legitimate target. So we wanted really in a positive way, use video game to promote the law of armed conflict. Healthcare in Danger campaign was launched by ICRC in 2011. The aim is to address the current violence against the healthcare sector. We talk about healthcare sector, it means medical doctor, nurses, ambulance driver, and people doing first aid, for example. So in the last years, we noticed an increase of acts of violence against the lifesavers, basically. So what we want to achieve is to raise the awareness of states, armed forces, but also the general public. As a judge for the Make Arma Not War competitions, I don't have very specific expectations outside the healthcare in danger part. So some can create missions, related to medevac or things like that. I say, if somebody wants to get a mission when you play a doctor or an ambulance driver, that could be fun. Not so sure, but why not? There can be also in the game mechanism. For example, in the game, there's not much care for the wounded. So maybe somebody can create a game mode where when you are wounded in a multiplayer game, then, if you are rescued, for example, by the other sides, giving you first aid and taking you to, the hospital, then you won't respawn and you cannot help your side. So that will maybe bring a lot of interaction around and a lot of value to the wounded. So it can be an idea. What we offer the winners is, something that you cannot really pay with money. Is 1 week with ICRC staff in the field. So we cannot tell you now where, and because we are active in many conflicts in the world, and not all of them are suitable for such a visit. But we can imagine taking you to a place where our surgical team are providing healthcare and war surgery to war wounded. Maybe to show you visit some places where people fled their houses, are been displaced or are refugees, and so you can have live interactions with people for who the war is a reality. What we offer you now is a little window to see the reality by yourself.